one of the areas where care navigators can have an important role.
I think it's good to learn elsewhere around the country. I mean, I was in Kent the other day, and there's a third sector organisation there called MCCH, and they fund brokers. These are people that work with service users to help them understand and use personal care budgets. And those brokers are service users employed. So they're not advocates, they're not navigators, they're actually a bit more than that. They get alongside people and they help them understand their rights, and they help them understand a care budget, a social care budget, and they help them spend that budget on what they want rather than what the system thinks they want. Now, we've got an opportunity inside this document. Again, it's a nice outcome, difficult to achieve. They're going to put health budgets next to social care budgets. So there are some places around the country. Now, in Kent, those brokers have been really positively supported by the emerging GP commissioners, the pathfinders. And it's a kind of double whammy, isn't it? Because they're giving work to experts by experience, by service users, and they're training those people with a set of skills, and they probably bring more soul to the role than some others. And then those people help the individuals spend money on what works for them. Real control, real power, supported by visionary GPs, turning outcomes into a reality. There are some places that are doing it. We need to applaud that, we need to learn, we need to share.
Just to add to that, I think one of the great, and that's fine, I go along with that, and I think that's an interesting example of practice. Yeah. We're not going to fall out about everything, but it's still creating tension here. But I think one of the things that is quite a big challenge to our centre is actually for the first time we'll have to market our services effectively, both to GPs and of course to our service users. In my own organisation, what's sort of rather typical is the social worker or CPN will bring somebody around and show them around, and we can give them a good time and show them what they can do with us and all the rest of it. And that's fine. I mean, actually, in the future, we'll have to be much cleverer about that, smarter about that, and get to the point well before the individual is brought to us, so that the GPs know what we have to offer, and those individuals and their advocates know what we have to offer. The big worry that's forming in my mind, and probably in many of yours as well, is how much we'll actually have to offer by this time next year. Any question? Any North East specific question? The question is raised, will the North East be proportionately less able to implement the mental health strategy due to job losses, high rates of mental ill health, and so on? Well, the short answer is a bit tougher. Obviously, and I've said this to my own organisation and to our service users in recent times, that when times were good, that was the best time really for people to be able to move on through the system and out of the system and into volunteering opportunities, and possibly training, education, and into employment. And that was great in good times, and people did. I think it was always more difficult in the North East because of its economic history, background, and disadvantage. And it's more difficult, obviously, in time of austerity and recession. That's not to give up on it. That's not to say it's impossible. To say it's, yes, I agree with the question. I think it's self-evident, more difficult. I think one of the difficulties I'm concerned about at the moment, particularly for our own services, is not just the lack of employment opportunities, but the potential lack of volunteering opportunities as well, as the third sector is under pressure and there's less scope within the sector for managing volunteers. So it's difficult. It's difficult times.
Thanks, Rick. Steve, you've got a couple of questions there for 5 minutes and then we'll wind up this session.
Table 5, how are we going to develop a national measure of well-being? I think what they're doing at the moment is looking at what's going on elsewhere around the world. There are 2 places that have done a lot of work before us in the UK. They're ahead of us, Australia and New Zealand. And so I'm aware of, I think it's a good idea to learn from others. So they're looking at the measures of well-being that have been used elsewhere around the world. I think the second thing they want to do, and it'll be interesting to see how they do it, is talk to people, talk to real people, get a sense of how they can develop a metric, a measure that meets in with that. So those conversations have started. How do you become an organisational recovery pilot? Well, there are 30 organisations, and those organisations are now set, so they're already in the programme. But what I can do is send Mental Health North East a list of those sites, and some of them may actually be in the North East, and if they are, then you can approach them and look to see how you can get involved. So I'll make sure you get that list. How do you overcome the table, there is no table. How do you overcome the avoid between strategy and what happens on the ground? I was involved in a really, was that your question? The table we were on? I mean, I think there are several ways of doing that. I mean, one of the ways is Mental Health North East. Bringing you together, making sense of difficult strategies, making sense of policy written in a bureaucratic language, giving you, amplifying your individual voices, giving you volume. I think that's really important. The second way is get to know your GP commissioner. Know who they are, know where they are, and start conversation. It sounds glib, but that's what you need to do. There are about 60 pathfinders already, with another 30 coming online. They're the groups that are already, in the next few months, starting to try and make sense of this difficult task. Commissioning is difficult no matter who does it. Just because you've got a medical degree doesn't suddenly make it any easier. It's difficult. A lot of the GPs I meet, many of them are actually quite willing to get some help. So find out who your pathfinders are. And then there's one from, it doesn't say table again, there's one that says, is the focus on recovery? The focus on recovery seems important in terms of moving to service user outcomes. But is this a guise to monitor staff and justify budgets in terms of service provision, thereby taking away the emphasis from the individual? The whole idea is that the organisations will be held to account around a model of recovery. So I don't think it is a guise, I think it's an attempt. Whether it'll work or not, I think we have to wait and see. But it's an attempt to make organisations work in a defined recovery model. So that they can be held to account by people like you. That's what I think it's about. I don't think there's an evil person that's actually decided that to carry out. This is, if anything, this is cock-up. If it goes wrong, it'll be cock-up, not conspiracy. So that's where it is.
Could I just ask Johannes, how do we get to? I think very, very good advice about get to know your GP commissioner. How do we organisations do that? Do we get to know individual GPs, or do we go to the chair, the people running the some dodgy private company?
Yeah, well, obviously it's about consortia. The GP are grouped in consortia, so the first step is to approach the consortia, and they will have a lead for mental health commissioning, and that lead will very likely work together with the team, the support team.
So that will be a GP.
No, I think that's very likely to be non-GP support, yeah, because we simply don't have the time to, and like some of this experience as well. So, but that's my personal opinion. That's still to be determined.
I wonder if anybody's tried that. Anybody tried that? Yeah. Did it work?
Well, as Johannes says, they're extremely busy at the moment. I think far more absorbed with structures and getting the right support in place GPs that I've spoken to are very interested and have ideas about, you know, changing and innovating in mental health and moving more into community approaches. But it's going to be a question of when we can get there. And I think it's going to be very hard for the voluntary sector because there's so many of us. We don't want to overwhelm GPs, but we also don't want to get lost, you know, lost in the rush. So it's, there's a tension between working together and getting a coordinated approach, and on the other hand, we are in competition with each other.
Yes,
okay, I'm conscious of time, and Johannes is just going to touch on these and then talk to you about his questionnaire before we go into the workshop. So, Johannes.
thank you. I'll be very brief. Just in our table there were a few questions as well, which I'm not going to answer, but I'm going to mention. One was about the tension between improving mental health and well-being in the population and actually this tendency that resources are drawn into improving the mental health and outcomes of individuals who have problems. So there's a tension. So that's one. The second question was about PBR, payment by results, and how that, some of the problems that you can get with that, and particularly with smaller organisations and payments that are made in retrospect instead of upfront. And the third question was how to tackle the issue which Steve also mentioned in his introduction, that many mental health problems actually arise or develop in the first 10 to 15 years of life, whereas actually they only become visible until much later on. So that has to do mostly with mental health and well-being in the whole population. That is a really, really big concern that we have as GPs, and that we really like to work with organisations like yourselves on that. And with the new health visitors. So yeah, and then finally, before we break up, yes, in this process of learning to find better outcomes for mental health and well-being, you're finding you pack a draft well-being skill that is the tail end of some work that has been done for public health and South Tyneside. I would like to ask you if we're trying to learn how these scales work and what the psychometric qualities are. There are a lot of scales for well-being around, and some of them have been designed for academic purposes, for instance with students. Some of them have been designed for population purposes, for instance for public health, for local authorities, etc. But there's a lot still to learn in terms of well-being skills for individuals. So, and this is an attempt to learn more about that. And we would be very happy if you could fill this in for your own situation and then anonymously drop it in the box, which Sarah has designed. She is 8. It's over there, and it mentions South and well-being skill.
Johannes, if people put their name on it, they would be entitled to a tin of sweets if it's drawn out at the end of the box.
So it's anonymous, but if you put your name on the back, or an alias is fine as well. That can entitle you to a big box of sweets, which could be good for your well-being, and for the people around you. But that's not necessary. You don't have to put your name or an alias on it either. If you just please put it in.
Thank you very much. We're now going into the workshops, and you all know which workshop you're in. If I could read out the room you're in for the particular workshop, what we'll do is